All right, we'll begin.
Okay. Right.
Good evening, everyone. A very warm welcome to all of you joining us today on Homeopathy 360. I'm Dr. Noori, Senior Editor at BJN, and it's a pleasure to have such a diverse audience with us this evening. I'm delighted to welcome our esteemed guest speaker, Dr. Vivek R, Associate Professor and HOD, Department of Organon of Medicine at Enepoya Homeopathic Medical College and Hospital, Karnataka. With over 8 years of teaching experience in Organon, Dr. Vivek is currently pursuing his PhD at Homeopathy University, Jaipur. He has published several scholarly articles, contributed to the book Spirit of the Organon, and was also awarded Teacher of the Year 2022 by Enepoya University. He is actively involved in research, academic events, and public awareness programs in homeopathy. We are privileged to have him with us today. In today's webinar, Dr. Vivek will present an in-depth discussion on the art of follow-up by revisiting Hahnemann's principles, where he will aim to bridge theoretical understanding with clinical reality about Hahnemann's guidelines on follow-up, remedy repetition, and second prescription as laid out in the Organon. I welcome you, sir, on Homeopathy 360.
Thank you, ma'am. Thank you for your invitation and welcome. Can I proceed with the slide presentation, ma'am?
Absolutely. While sir is sharing his presentation, I would request the audience to please drop your questions if you have any in the Q&A box, and we'll take them in the end of the session. Over to you, sir.
Okay, ma'am. Ma'am, I hope you are able to see the slides.
Yes, we can.
Okay. Okay. Good evening, all. For today's session. So the topic for today's session is the art of follow-up, revisiting Hahnemann's principles. So before going into the discussion, my gratitude to our master, Dr. Samuel Hahnemann, without whom we are not here. So thank you, sir. Okay, now coming into the topic. So we all aim to practice homeopathy somewhere, and we all aim to cure the patients, right? But whenever we start thinking or start prescribing, we expect that the patient is going to get cured in a straight way, easily. Like you prescribe one dose of a medicine and immediately you are going to get cured. So this is what is the expectation that we all have in the mind, at least as a beginner. But when we look at the realities, we prescribe a medicine and you can see that there are a lot of options that is possible after we prescribe a medicine. Like we should wait, or like aggravation is there, amelioration is there, whether miasm is there, house cleaning is there, layer shift is there, complaints are changing. So these many realities are there, and ultimately we reach cure. This is the actual reality. But whereas in our expectation, it looks like as if we give a dose of a medicine and immediately it leads to cure. So making the first prescription is always easy, some comparatively. Maybe in the beginning we find it little difficult, but as we move on, we become experts in case taking, and also we have our own methods of reaching to the first remedy, and there is no problem in giving the first medicine. But it is not everything. Actually, the whole problem, or like the problem starts after the first prescription is made. Then we have to see how to progress still further, and how to take up, whether what direction to be taken, whether it is going the right direction, should we wait, or what to do. That is where the whole problem lies. So today we will see what is the different options available and how to proceed further. So when we see Hahnemann's writing in chronic diseases, Hahnemann says about the treatment of chronic diseases, their beginning was promising, their continuation less favorable, and the outcome was hopeless. So this is what Hahnemann has told about the treatment of chronic diseases prior to the discovery of miasms. So he had difficulty. Of course, we all know why Hahnemann discovered miasms in the first place. He had difficulties in the treatment of chronic, right? So what he found was, like, initially whenever he was prescribing medicines, it was giving good reaction. There was good amount of improvement happening. But slowly, as he was progressing, he was trying to repeat the medicine or to trying to change the medicine. Then he found that it was like less and less effective. And ultimately a point comes where it doesn't even create any sort of reaction. So Hahnemann was not finding this problem with one or two cases, but with a lot of cases. And that is the sole point why Hahnemann started thinking about the concept of what could be there behind which is not allowing cure to get completed, and this led to the discovery of miasms, after which this problem was like not all present. But in today's world, even though Hahnemann has found all the solutions for all the problems, but still somewhere we are stuck in between. Why I'm telling this? Because even to the present today, we all experience, in the beginning there is a very good reaction we observe when we prescribe a medicine. After some time, what happens, the reaction is slightly becoming less. The patient tells, sir, the complaints are persisting now. The first dose what you gave, that was the best one, can you please give the same medicine? So this is what we see. Of course, sometimes you would have given the same medicine, but still the patient tells there is no much improvement. So still we are facing the same difficulties nowadays. Why? Maybe because we have not understood Hahnemannian principles properly. Because practically speaking, Hahnemann has given the solutions for all the things, but practical problem is it is scattered everywhere in most of his writings, like in Organon, let it be, or in lesser writings we can find in his articles, or in chronic diseases. It is all scattered here and there. So here in today's session, we will try to concise and like compile everything and see what are the different possibilities and how to overcome those hurdles in our clinical practice. So the objective of today's session will be to understand about the follow-up situations and the suitable management strategies. And also we will have a small discussion about the differences observed in relation to understanding follow-ups in terms of centesimal scale of potencies and also when we use 50 millisimal potencies. Okay. So now coming from the beginning. So whenever a patient is coming to us, we have three possibilities. This is what we have to always understand. Whenever a patient is coming to us, we have three possibilities that can be done with the patient. The basic thing that we expect is the cure. The next one we expect is palliation. And the next one we don't expect and which we should avoid is the suppression. Practically speaking, we always aim for cure, but sometimes it may lead to palliation. And there are some cases where it is only a case of palliation, like incurable cases, like the terminal cases, like cancers or even any chronic disease in its end stage will become a palliative case. We cannot, because there is an irreversible pathology and we cannot reverse it completely, and cure is not possible in such cases. So palliation is allowed in some cases. Intentionally it can be done, and sometimes we expect for a cure but unintentionally it leads to a palliation, and sometimes it does lead to suppression. Okay, so suppression is not at all a good thing, especially with homeopathic medicines. Of course, we all criticize with the old school medicine that they always try to suppress all those things. It doesn't mean that our medicines are like only can cure and palliate, but they do have the power to suppress cases, but not so easily. And we will see today also like how to avoid suppression and what are the signs that indicates that it is going for suppression. So to understand about today's session, we need to understand some basic principles. The most basic thing is the Hering's law of cure, or then the knowledge of disease progression. How to gain this knowledge? The knowledge of disease progression we can understand by a thorough knowledge in surgery, pathology, and also textbook of medicine. Then also we should never forget the different causes as per homeopathy: the fundamental cause, the exciting cause, and the maintaining causes. So these are the basics which will help us so much in the follow-up. Of course, in the first prescription, case taking is required, and case taking is a continuous process. Sometimes we may not get everything in the first sitting, but of course in the follow-ups also we will get. But I am not going into the details of how to take the case properly. But for the sake of follow-up, these are the basic things that we should understand very clearly. So we all know the famous Hering's law of cure. Cure takes place from above downwards, from within outwards, and from more important organs to less important ones, and in the reverse order of appearance of symptoms. See, this is the beauty of homeopathy. Homeopathy is the system where cure is defined so beautifully. I don't think any other system is having such a clear-cut definition of what is cure, because everywhere it is all about symptom management, but we have a very clear-cut definition of what is cure, what is palliation, and what is suppression. And Hering's law is something which helps us. It is like the guide, like the compass in the sea. Without a compass, we are lost in the sea. But with this compass, we'll be able to find direction and reach the place which we are intending for. So this Hering's law is something very simple but very effective for us to help, means get the help of getting the direction, which direction we are going. Okay, some general instructions which we can easily follow is like setting up a follow-up criteria. which will include the generals and particulars. I think this we are all aware of what is a follow-up criteria. Every time a new case comes to us and we prescribe some medicine, after the patient leaves, it is good for us to go through the case and set some criteria like the symptoms in the case, which we expect some positive changes in the next follow-up. Mostly we consider the most troublesome symptoms in the patient, which is pertaining to the particulars, and also we include the general symptoms. That means the symptoms which are physical generals or mental generals, which have been like so much abnormal, and we expect those changes to be altered in the next follow-up. So during follow-up, apart from follow-up criteria, consider new generals and also particulars. So apart from the follow-up criteria symptoms, we will also ask the patient if there are any other new symptoms or any other altered generals which are present after the prescription is done. So now coming to the follow-up possibilities. So before going to the discussion, I wish to tell you that this is not a traditional explanation what we find in the textbooks. Of course, it is taken from there, nothing new. But today we are going to take up a patient-based approach. For example, when a patient comes to us in follow-up, what the patient is going to tell us, from there we are going to understand or approach the textbooks. So whenever a patient comes to us in follow-up, these are the most commonest possibilities that we can expect. So first one is amelioration, aggravation, no change, and other possibilities. So we will go through one by one. As the patient comes, then we will see what we can expect. So first is the most commonest thing we all expect and which we all love to see in a patient, that is amelioration, and there is not no much explanation required for this. But one point what Hahnemann tells is sometimes we'll not be able to see a clear-cut open amelioration of symptoms, but even in such cases, there is one hint that can show us very clearly whether the patient is improving or not, and that is the state of the mind and the whole demeanor of the patient are the most certain and instructive signs. So this is what the exact words were told by Hahnemann in the aphorisms. So the mind, in short, to tell the general symptoms, the physical generals and the mental generals, especially, they will feel so much comfortable. Probably the person was like feeling restless and like angry, and he was not in a state of peace in the mind. But after the medicine has been taken, probably even if the particular symptoms have not improved, if we are able to find out that there is a general peace improved in the mind and also in the physical level, then probably it is a short sign of amelioration. So this is what Hahnemann tells. Even with slight improvement, we can see a greater degree of comfort, increased calmness and freedom of the mind, higher spirits, a kind of return of the natural state. So amelioration, whenever we speak of amelioration, there are two possibilities. It can be like a very striking amelioration, or it can be like a very slow amelioration, like it is not as fast or like as quick as we have expected in the patient. And I'll explain you why it is important to understand these two types of amelioration. So in the strikingly increasing amelioration, if at all you had prescribed a dose of a homeopathic medicine to a case and you are seeing a very prominent and very clear-cut amelioration, there is no doubt for you that the patient is improving, then the best thing to do is like wait and watch. No need of any sort of repetition, no need of interfering with any other supportive medicine. The most commonest mistake all we beginners do is like, okay, there is an improvement, so why don't we give another dose to hasten this improvement? This is what we always think in our mind. But Hahnemann has very clearly instructed, even if the first dose has improved the case so much, if at all we are means in a haste we are administering another dose of even the same medicine, then there is high chance that the dose will interrupt, delay or disturb the curative action. So it is always well and good, if at all you observe a very clear-cut amelioration of the case, then wait and watch. Do not disturb the case. It will probably finish the case without any further repetition or change of medicine. So there is no problem with the first scenario. Now coming to the second scenario, slowly progress amelioration. The patient tells that I am feeling better, but it is like only slightly I am feeling better. It's not like so much improvement is there. So now what to do? What Hahnemann tells. So Hahnemann tells sometimes a single dose of a medicine can bring about cure, but the thing here is it will take a long period of time. Maybe like Hahnemann tells 40 to 60 days, or like maybe 80 days or 100 days of time. and it will definitely cure the case. But Hahnemann, as we all know, he's a very sensitive personality. He that all his writings are like the ideals, like the highest expectations. And Hahnemann's second aphorism expects us to have a very quick relief, rapid improvement of the case. So Hahnemann found out his own way to reduce the time taken for cure. So he has given three clear-cut instructions to reduce the time taken for cure. First one is the medicine selected should be like absolutely homeopathic, means a very properly selected medicine based on the symbolism. Then we have to administer the medicine in a very minimal dose. And third one is the most important one, careful repetition. So he instructs us to repeat the medicine at suitable intervals. He is not asking us to repeat in a very fixed pattern, like every day you repeat, or like 10th day you repeat. No, he is not asking us to repeat in a mechanical way, but he is asking us to repeat at suitable intervals. So that suitable, that word suitable intervals is like having so much of meaning. And I'll give you some hints. I'm not going to the details of that, but maybe you can consider Hahnemann has given three clear-cut points even for considering the repetition. That is the nature of the medicine, then the nature of intensity of the disease, and also the corporeal constitution of the patient. So these are the 3 points that Hahnemann is asking us to consider to decide upon the repetition for that particular case. So to repeat again, it is like the nature of the medicine and the intensity of the disease, and also the corporeal constitution of the patient. So nature of medicine, we mean whether it is a superficial acting medicine or a deep acting medicine. We all know each medicine has its own kind of action. Some medicines are like very superficial, maybe acts for 1 day, 2 day, and even some medicines may have a very shorter duration. But some medicines like the deep acting polycrushed medicines have even 60 days. One dose can act even for 60 days. So the easiest way to identify which are the medicines that are superficial and deep acting medicines, please refer the Boeric textbook of Materia Medica, where in the last section there is a very beautiful table given where it gives about the relationship of remedies also, so, and also about the duration of action of medicine. So we can easily identify that whenever you are prescribed a medicine and the patient has come to your follow-up, definitely open this section and see what is the duration of action. So some idea we'll be able to get. Next is the nature of disease or the intensity of the disease. So if it is acute disease, then probably it may require frequent repetition. But if it is a chronic disease, probably we can delay the repetition. Then the next one is the corporeal constitution of the patient. So in short, I can tell you like the sensitivity of the case. Maybe the patient is like oversensitive and he is like highly reactive. How to identify the patient is reactive, that we can easily identify the case history or maybe the reactive pattern of the mind or the reaction of the physical reactions of the individual. This will help us to understand about the corporeal constitution and the sensitivity of the individual. If the sensitivity is high, then probably we need not go for a repetition. We can reduce the repetition. And if it is like not highly sensitive, like little dull kind of people, little slow in the moment and also in the mind, then probably we can think about um, increasing the frequency of repetition. So this is what Hahnemann tells, instructs us if we wish to reduce the time taken for cure in cases where the patient comes to you in the follow-up and tells, sir, I'm improving, but not that much, only slightly improvement is there. But a word of caution here, we should never be in a hurry. We should never be in a hurry to go for repetitions. So maximum, if you are a beginner, then let us wait maximum possible time, then we can go for a repetition. But if you are very sure that this case requires repetition, and based on Hahnemann's instructions, we can safely go for a repetition of medicines and we can get a beautiful improvement in a very shorter period. So these first two categories are very simple categories where the patient is coming and telling that improvement is there and there is no much problem. There is an improvement in the general level also. General symptoms, that means the sleep is improved, the stool or the urine, all those things are like good, and also the particular symptoms have improved much. Then we don't have much of complications. So most of the cases will fall under this category. But there is another category where the patient is coming to you in the follow-up. You are prescribed medicine, then the patient is coming to you in the follow-up and tells that, doctor, I think my complaints are better. My particular complaints, everything is like better. And also you find, because I told you in the beginning, we have to look for new changes or new symptoms in the level of particular side or also on the general side. So here what you observe that the patient is giving out some new kind of symptoms, and when you observe this, you feel that the disease is progressing somewhere, like the disease progression is happening, even though patient is telling that the patient has improved somewhere, but you have signs which indicate that this is not going in the right direction. So even though patient comes and tells it is an amelioration, but we have to be very cautious in approaching such a case. Actually, it is not a case of a true amelioration, but it is actually a true aggravation that is happening in the background, and uh, we have to prevent the further progression of the disease. Maybe we can go for an antidote if possible. The example that Hahnemann gives here, or even other people give, is the maybe the old tuberculosis cases where the complaints are gone, the symptoms are not there that much, but there is a focus which was there present inside, which was a closed focus. But after you had given a medicine, probably the symptoms have come little better, but you observe that maybe the patient is starting to cough up blood or something. So it indicates that the focus has been open. Maybe when you had given a very deep acting medicine, for example like silesia, that is why many stalwarts give a very clear cut instruction whenever we use deep acting medicines like silesia, because it is called as a surgeon's knife. Sometimes it opens up things which are not supposed to be open, especially in incurable cases. So here we can find maybe the patient is telling that he is better, but actually you have to understand the patient is not improving. So antidote is definitely required in this case. Otherwise, it may go for a severe aggravation later. Otherwise, maybe if you are finding any other similar medicine, then probably we can go for the medicine easily. So next, coming to another scenario where the patient is telling that the particular symptoms of the case are better, but generals are not good. Means the physical generals is not good, or even the mental generals has not been improved. Otherwise, it's the same. Then probably the medicine is only acting in a superficial level, and we may have to reconsider the prescription. Here, the medicine is probably a palliative medicine. Maybe we have not got the complete symptomatology of the patient, and that is why we were forced to select a superficial acting medicine or a wrong medicine in this case. So we may have to go back to the case and reconsider the whole prescription. Okay, so here I am thinking of a case where we had prescribed for a case of an allergic rhinitis. They had come with some complaints, and we had prescribed Sabadilla 200, which is probably a kind of routine prescription. And after that, we found after a week, the patient came and told that the sneezing and running nose has come down, but generally the patient's sleep has become disturbed. So this is what gave us the indication that probably our medicine is not acting in the way that we have expected to act. So it is always better to go for overall totality of the patient rather than going for a sector level prescription. Here a sector level prescription was made, and it was not so good in the first follow-up, and so then we reconsidered the case. Then we prescribed a single dose of natramur based on the symptoms of the patient, and then it gave a very good improvement, with improvement in generals also and also improvement in particulars also. So there are n number of cases, especially this is very important because in the current day, most of we young beginners, we are like expecting to give a palliative relief to the patient, and we are in a haste to prescribe some local medicines or like sectoral medicines. So it may work well in some cases where it is actually required, but it is not required in all the cases, because always the best prescription is to go for the overall totality and prescribe for the constitution of the case. Next scenario comes where the patient is feeling better in the initial days. After a single dose, the patient comes to you and tells that he is feeling better, and so you decide to wait in this case, and later you ask the patient to come. You prescribe placebos and you ask the patient to come after another 2 weeks. Then you find that the patient is slowly going in for an aggravation. So this is not such a good indication probably, and so maybe the medicine was only superficially acting and it has tried to palliate a little bit, but it has come with a rebound phenomena, like where the symptoms have like increased in the secondary action, and somewhere it is not right. Or maybe the patient was like incurable and the remedy was only slightly uh, working there. It is not the correct remedy that we have prescribed for. So what to do in such a case? Then we have to reconsider the case definitely, and we had to look. Maybe in some cases there will be some obstructions like the diet and regimen. The patient is gone for a trip outside or like had some unusual things in the diet. What we had advised, maybe don't go for a cold exposure, all those things. So that was like broken, like they did not follow the advices properly. That also is another reason why it can be observed like this. So after you rule out any maintaining causes, and if there is no maintaining cause present, then probably we have to reconsider the case, and maybe it is a case of a palliation or the medicine is like only slightly suitable for the case. So to short relief of symptoms. So here also what happens, a patient comes to us, we prescribe a medicine and we expected the medicine will act for a long duration of time, but what has happened is it is giving only a very short period of improvement, and again the complaint is like relapsing back. So this is often seen in case of acute complaints where the severity is like so much intense. So what we need to do, there is a requirement, there is a need for frequent repetition in such cases, because there is a crisis which is happening in the body and the disease is like acutely stronger. And so to overcome the disease, we may require to prescribe frequent repetitions or frequent doses. And so that is fine. But also we have to rule out the maintaining causes. It may mean the disease is intense and maybe deep pathological state is on the way. So there is another possibility where it could be due to a deep pathological state and it is not in a good direction. So what to do again to reconsider the case? Now coming to a partial amelioration, this is like a Ken's seventh observation where amelioration is there, but there is no special relief. So this is often seen in cases of deep pathological conditions in the end stage diseases of patients where there is an irreversible pathology which is existing in the case, and we cannot truly bring about cures in these cases. So what is actually possible, maximum possible, is a case of palliation. We can make the patient comfortable at a sector level, the symptoms will be like better, but we cannot assure any further progress in the case. And this is a true case of palliation, and that is all we can do. And the medicine selection is correct, and preferably not to go for a very deep acting medicine. Sometimes we consciously avoid prescribing deep acting medicines that are more suitable in such cases, because in a place where there is no place for reaction to happen, it may bring about a reaction and it doesn't go well. So here I remember a case of bronchiectasis, where the patient has come to us with complaints of recurrent cough, maybe for many 8 years of duration, and there is an yellow expectation, offensive breath, and recurrent fever. Now and then fever will be there, and the generals are like altered generals, all those things were there. But on looking at the investigations, we found that there is some amount of irreversible pathology present, and we understood that the case is like incurable. But what we can do is go for a palliative measure. So we started with the basic medicines like antimt, which gave improvement for some time, but after that again that medicine also has stopped working. Then some symptoms had changed, and especially there was a very strong weakness that was present along with the cough. Then this indication led us to the prescription of Stanum Met. If you look in the Metra Medica, you will understand it is a medicine where there is a weakness stage along with the respiratory complaints. And this medicine is now still the patient is under the same medications. Repetition is done only when required. In very infrequent doses, repetition is done, and the patient is able to maintain his symptomatology with this particular prescription. So here, what is the point here? Here, there is only partial amelioration possible. That means it is an incurable case, only a case of palliation. So these are the different options where the patient is going to come to us and tell there is some improvement. Now we will go to the next section where the patient is going to come to us and tell that the complaints have increased. So as we saw that there are certain indications where we understand that the case is going for an amelioration. Similarly, we can understand whether the case is going into an aggravated state. The same symptoms, the opposite symptoms of what we found in amelioration. Here, a constrained, helpless, pitiable state of the disposition of the mind, of the whole demeanor, and of all gestures, postures, and actions. And sometimes there will be new or increased existing symptoms. So the easiest way to understand is the patient is going to come and tell that the existing symptoms have increased. This is the most easiest understanding we can have. Otherwise, if it is not very clearly understandable also, again, we have to look at the general state of the patient, both the physical generals and the mental generals. And if there is a reduced level of comfort compared to the first sitting of the patient, then probably it is a case of aggravation. And here also, and also in case of amelioration, both the places, it is observation is a very important thing to do. Sometimes the patient may not tell it very clearly with words, but our observations can help us understand whether it is going into a state of aggravation or amelioration. So here Hahnemann adds a dose of means a note of caution that it is always important to give a minimal dose to the cases. Otherwise, it can easily go for unnecessary aggravations in case, and this has to be insisted again. As beginners, we always tend to give large doses of medicines and frequent repetitions, which is not required. Let us go for a minimal dose. At least as a beginner, we should start with minimal dose. The most minimal dose is the single dose, and then wait or allow sufficient time for the medicine to act. Then we can go about changing the medicine or go for a repetition. So when we speak about aggravations, the most commonest types we can easily understand is homeopathic aggravation, disease aggravation, medicinal aggravation, and Sheen symptoms, which are seen in case of which are seen in case of 50 millisimal potencies. So homeopathic aggravation, we all know this case where the medicine is exactly suitable, but only problem was the dose was a little larger than required, and so it has intensified the already existing symptoms in the case. And this is a true homeopathic aggravation. So why homeopathic aggravation is happening? Because in the primary action of our medicine, it is attacking the same places as that of the disease, and our medicine is always stronger than the existing disease. So this is the reason why the patient may feel that there is an increase in the complaints. Okay, so coming to the point of homeopathic aggravation, this is the most expected part in any physician's life. Many of the physicians practically expect an aggravation to happen or occur after a prescription is made. And I have seen so many cases of patients who come and tell us, doctor, the complaint increased and then decreased. So they are used to this, that they have adopted and understood the homeopathic principles, that they only come and tell, doctor, yes, doctor, I think I know, doctor. Usually the complaints increase after the prescription and then definitely it will go for a cure. So it has become something like a norm that everybody started expecting homeopathic aggravation after a prescription is made. But Hahnemann is not comfortable in seeing aggravations, and we all know the second aphorism: highest ideal of cure is rapid, gentle, and permanent restoration. See, the word to be understood is gentle. He doesn't want any sort of aggravations in any case. Because according to him, the patient is already suffering and he doesn't want any extra suffering in the patient. Here I remember a case of sciatica where there was a back pain, that means IVDP along with sciatica was there. The patient went with a lot of treatment, and only when they take the painkillers they used to feel better, but otherwise the complaint used to be very recurrent. They had tried a lot of treatment methods for almost 8 years without much of relief on long term. Only whenever the severe complaints are there, they'll take about it, but they suffered a lot with that. They had come to us and we took the constitution. There were right-sided complaints where there was some history in the mind where the patient is little sensitive and is sensitive to the family members, and there is a weeping tendency, and thirst was decreased. A typical picture of a pulsatilla was there, and we prescribed a single dose of pulsatilla. And what happened after that? For the next 2 days, the patient came back immediately. Within 2 days, the patient came back and told that the complaints have increased so much. So usually we will have a very big doubt of what is happening here, but we saw the case very clearly. And a point to note here, even the general symptoms, patient is not able to tell, because whenever they are in pain, they will not be able to tell whether the generals have improved or not. So what we did, we waited. We gave just a number of doses of placebo and waited. And what happened was like a very nice improvement. After 4 days or 5 days, the patient's complaint improved so much that the patient started experiencing a relief that the patient did not feel for the last 8 years after taking so much of medication. And this was not one time. After some 2 months, the patient required a repetition because of relapse of symptoms, and we prescribed the same dose. What we observed was again a aggravation. So there are some cases where aggravations are seen, and it is an indicator that the medicine is in the right direction. But if possible, then it is very good to reduce these sort of aggravations because it increases patients' complaints. So coming to the next possibility, a quick, short and strong aggravation with rapid improvement. This is a famous Kent's third observation, which we all expect. So the medicine is correct, the vitality is good and often seen in case of acute complaints. The maybe even some small structural changes like a small superficial pathologies can come up. So nothing to worry if it is all superficial level, means it is in the direction of Hering's law of cure, then there is nothing to be worried. So easily we can wait and watch and not to disturb the action of the medicine. So long aggravation and then final decline. So this is something which we all have to be very cautious about, and I always suggest all the beginners to go cautiously with some percentage of cases in our OPD practice. Okay, so if we take the number of patients who are we are seeing, then most of the patients fall into the category of an average level where they don't have a very deeper pathology, and around 5 to 10% in a regular OPD setup. If we find there are some 5 to 10% of cases where they will have some deep pathological condition, and maybe it is not yet diagnosed also, but still they will be coming to you. We have to diagnose these cases properly, and we have to definitely understand how much of pathology has happened in these cases, whether it is in a reversible state or it is in an irreversible state. So what happens in such cases, if especially if you are going for a single dose of a deep acting medicine, then probably it will create a destruction rather than improvement. As I already told you, there are some cases where cure is not possible, and when a deep acting medicine is given, it tries to establish cure by acting over the pathological condition, and this will create more destruction rather than improvement. So the vitality is the key to be understood in any case, in any patient that we are going to see. If we had to be a little cautious, just look at the vitality of the case. So how to understand vitality? You examination, physical examination and investigations are a most important and easiest method to understand the vitality of the case. Sometimes even the patient may not be like expressing much of the symptoms, but when you look at the symptom, when you look at the investigation, we understand that there is some deep pathology. Example, in case of psychotic cases and all, there will be a lot of deeper pathology happening inside, but outside you may not be able to see much of expression of symptoms. So we should not misunderstand that the patient is having a good vitality. So with this, we'll be able to understand that if you understand vitality is not good, then be cautious. Don't go with deep acting medicines. Even if you choose to go with the deep acting medicines, then the potency choice and the repetition matters a lot here. So that is definitely a wrong selection for that particular case. So antidote at the earliest identification, otherwise it can prove to be very worse. There is another possibility in such cases. This is the Kent's second observation. We all know this: long aggravation and then final improvement of the case. So we all know what it is happening here. There is some deeper pathology that is happening inside the case, but it has not reached to the level of an irreversible state. It is in the borderland, and luckily we escaped. Maybe we didn't look at the vitality of the patient properly. We thought the patient is having a very good vitality and prescribed some deep acting medicine. So what we observe in these cases is it will go for a very long period of aggravation even after single dose, and finally it will come up with an improvement. So, and this is also like mostly hit and miss, and this is not expected. The first two observations of Kent is actually must be tried to be avoided as much as possible, because it is out of luck that it can happen that the case is irreversible, because there is no fixed straight line where we cannot draw a line. Okay, this case has become irreversible, especially when it is still in a reversible state. So it is very difficult to judge in this situation. So it is better not to take a chance by giving two deep acting medicines. Otherwise, at least we have to be careful with the choice of the potency, at least in such cases. So I'll tell you in the last part These kind of cases, it is better to go with the 50 millismol potencies or LM potencies, where it is like showing very good improvement in the end. So here I remember a case of a chronic bronchitis of a 68 years old lady who had complaints for many years, and they had come to our OPD, and they were prescribed with the usual medicines, and they were feeling much better. But we found that the patient is not improving beyond a point, and like usual, we thought, okay, maybe the patient requires an intercurrent remedy. And what we did, one dose of deep acting nosode, I remember it as tuberculinum, one dose of 30 potency was given. And after that, what happened? The patient started declining actually. It became like worse. The aggravation started becoming worse. And after some 1 month of severe aggravations, the patient became much better than the previous state. But we understood that this could have been avoided maybe if we had not given the tuberculinum at this stage. Maybe we should have revived the vitality of the patient in a better level, and then we could have given it. But that was a learning for us, because that 1 month of suffering was like too much difficult for the patient also. And since we are given a deep acting medicine, it is difficult to interfere the action of such medicines, because it will further complicate the case. So this is the problem. Practically speaking, we can imagine, okay, we gave a wrong medicine, immediately we'll do something. But sometimes it becomes too complicated, and we add one more medicine, it adds another complication. So it is always preferable to avoid such complications in the first place. And how to do that? Check the vitality of the case in the first sitting itself, and it will help us to avoid such situations. So these are the situations where the patient is directly coming to us and telling that there is a sort of an aggravation. Now we will see the other possibilities. Now we are coming to the possibility of there is no change after the prescription is made. We had made a prescription, and the patient is coming in the follow-up, and the patient tells that there is no change, doctor. Nothing has changed. Probably usually we give for a 1 week follow-up or a 2 week follow-up. The patient comes back in 2 weeks and tell that I don't find any major changes after the prescription. So here, first thing we have to see is whether should we wait again or not. So how to decide again if we have to wait further or not? As I already told you, please look at the nature of the medicine, whether it is a deep acting medicine or a superficial acting medicine. Then wait. If it is a deep acting medicine, then definitely wait. If it is a superficial acting medicine, then probably the medicine has not taken any effect. Then there is a chance that we can go for a change of medicine. But especially in chronic diseases, you better wait for a sufficient period before changing the medicine. We must never be in a haste to see the changes, because in theory it becomes easy to tell, and for you also to listen, it is very easy. But when we are sitting in front of a patient during a follow-up, the patient comes and tells that, doctor, I don't find any improvement. Then the moment, more than the patient, the physician as a beginner will get so much tensed and anxious. Ayo, not acted, then we have to do something, we have to do something. That anxiety is something which we have to avoid at all cost. And if we understand the movement and the actions of the medicines, and we understand all these Herring's law of cure, all these things, then maybe we'll get the confidence to wait in those cases, and then make a very strong step later on. So we must not be in a haste to see the changes. And also to note here, there are some medicines which have a very slow pace of action. For example, like the Silesia and also the Apis mellifica. And this is the reason why we have to read the Materia Medica, the short sentences, maybe the introductory section or maybe in the last part of the medicine. Usually what we do when we see a Materia Medica is look at the particular section of the head section or the respiratory section, that we concentrate more, but we forget to look at these introductory part or the end part of these Materia Medicas. This is where gems are written. Apis mellifica, for example, and also Silesia, they act very slowly. The pace of action is very slow. In these conditions, if you are given any of these medicine, then allow sufficient period of time for the medicine to act. It will bring out the action, but in a very slow pace. Maybe you can even wait for 1 month easily if such medicines are given, where it is known to have a slow pace of action. Other medicines, if it is usually supposed to see a fast pace, then maybe we can think about other options. But patience is very important in follow-up. because the moment we had made a prescription, already there is a complication going on, and this point of time you add any other extra medicine, it is going to complicate it in a much larger way, and it is always better to avoid such things. So now is the first scenario. The patient is coming to you and telling that, doctor, my complaints are still the same. It is not much better, like that the patient is telling. And Hahnemann is has told about this scenario in aphorism 254. So here the problem is the patient may be intentionally lying because the patient is expecting a very strong dose this time. That is why they may tell like that. But sometimes the patient may be unintentionally telling this because every human being has their own thing to do in their life and they'll be busy with things. Maybe they'll not be able to compare it very clearly what was the symptoms that were present in the first time and what were the symptoms that are present in the current day. So how to overcome this difficulty? Just go through the complaints that we have written in the first sitting in the case sheet. Go through each symptom one by one to the patient and ask how is this particular complaint, and probably the patient will come to the awareness that the complaints have improved a lot. This is far more frequently happening in clinical practice. So we have to definitely ask. So what I'm trying to tell is, like, we should not get immediately tensed. Okay, something wrong is happening. No, first do this. First observe the patient and look for the changes in the general state, and also then look for the particular symptoms, whether any changes are there. And most of the times improvement will be there. Maybe it is like a very mild improvement that is happening, so we don't have to worry much. But when the patient is coming to us, he will tell that the case is like showed like there is no progress or no change happening. So if at all we consider all those things, but really there is no change, no improvement has happened, or like no aggravation also has happened, no amelioration also, or nothing, no reaction has been established in this case, and we waited for a considerable period of time for the medicine to act, but still there is no change, then what to do in this case? Then probably we need to reconsider the case. We have to go for the causes. If there are any maintaining cause which is there, which is preventing the action of the medicine, and then if still nothing is there, there is no maintaining cause, there is no exciting or nothing is there, everything is fine, then we may have to go for a reconsideration of the totality. And if still nothing is coming up, then we have to reconsider our prescription. Maybe there are some cases where there is no reaction established after the usual set of medicines. So this is the place where we go for lack of reaction remedies or lack of reaction medicines, like maybe low susceptibility states, or maybe the susceptibility of the patient is already exhausted to bring about any reaction with the patient. So here we can go with other options. Maybe we will see continuously what are the other options available for us in this direction. So maintaining causes. If maintaining causes are there, then it is very difficult to expect any sort of improvement. And in terms of maintaining causes, especially in chronic diseases, we know that there is something called as pseudochronic diseases, and maybe a poor posture, or like a very cold climate, or maybe a constant workload, otherwise poor diet habits, or like maybe addictions. These are all there in the regular day-to-day life. Maybe we had forgot to ask the patient about these things, or maybe the patient has been advised to stop these things, but the patient has not changed these things. So here there is no point in expecting a very good improvement in such cases, and there also no improvement can happen. So here the point to be noted is, more than the homeopathic prescription, the first thing required is a general management to remove the maintaining causes. Then next comes the scenario of true surgical diseases, like for example an athlete who has run for a marathon and then got an ACL tear, complete tear is there. Yes, by simply giving a medicine alone, it may not be possible to improve the case. Pain will be persisting and the patient will have clicking sounds. So it may not improve with medicine. So we have to understand the diagnosis of the case. The same, a similar example of this wisdom tooth pain. Many cases we get with the toothache, and sometimes there is a palliative relief, but sometimes we are not able to give that palliative relief because it is a maintaining cause which is persisting and not allowing the patient to improve. So next we have to look for the obstacles to cure. This could be in any direction. Hahnemann has very clearly mentioned about this in 259 to 261 aphorisms. So habits and addictions, we have to look for any smoking habits, drinking habits, or any other habits Then allopathic medication. This is a very big issue in the current day. Most of the patients coming to us are already coming after taking a lot of other system medications, especially allopathic medications. So it could be the effect of the medicines also, maybe the usual effect of the medicines also that we are observing as symptoms. So it is always ideal to note down the list of allopathic medicines and the doses that the patient is taking. So maybe if we are not able to find any other way, maybe we can look at a solution in these places and see if anything is possible. Then some patients go for a changed diet, thinking they only Google something and change the diet, and then they don't tell it to us also, and we also fail to ask. And sometimes that could pose as a problem, as an obstacle to the cure. Then many people I have noticed they take some sort of herbal medicine, especially the old people, they take some churnas or some herbal medicines every day, and it is a habit to them, and they don't tell it unless we ask specific questions to them. Also, sorry, the local applications that the patient use contain many camphor, menthol, or menthol, all those things can prevent the action of a medicine, so no action could be observed. Cosmetics and perfumes is a very big thing, very common nowadays in the like urban areas. So these all definitely has some impact in the action of the medicine and prevent the action of medicine. Also, improper handling, improper storage of medicines, storing medicines like open caps and not closing it properly, or keeping it in physical agents like heat or like too much of cold. These things could affect the action of the medicine. That is why medicine might be right, but action is not observed in such cases. So the next problem that we could be possible is the potency problem. This is a very big issue, and this itself will be a very big topic, so I'm not going into the details, but definitely we have to consider the potency, reconsider the potency. Maybe this potency is not acted and we reconsider the case, but still the same medicine is indicated. Maybe we can think about changing the potency. The easiest option is maybe after everything the medicine that we had selected is not the suitable one for this case, and it is a wrong medicine, and it has failed to establish any sort of reaction in the patient. So next comes to the unusual scenario. What Hahnemann is a genius. That's why I always tell Hahnemann is a genius. He has understood the nuances so nicely. Like he has gone to the extreme possibilities in the treatment, and he has given solutions for everything. So this is one problem. But as of now, I have not found this much in the clinical practice. But he has written about this also, alternating action of medicines. Some medicines have dual kind of action. Maybe it is having the tendency to produce diarrhea also and constipation also in an alternating states. So when we utilize such kind of medicines in our treatment, then maybe the first dose may fail to bring about the expected result. But when the patient is coming to us with no results, no improvement, then we have to retake the case, and we still find the same medicine is indicated. Then Hahnemann has instructed us not to worry, just give another single equal dose of the same medicine, and he tells that this will bring about the expected result. So this you can share in the chat box if anybody also of you have experienced this alternating action in the practice. But still, that is a point to be considered if at all we are stuck and not having any other options to go. So in such remedies, whenever we are using any remedies which have a clear-cut alternating action, it is better not to repeat it too frequently, because it can create a counterproductive effect. So these are the options where the patient has come to us in the first, after the first sitting, we have prescribed a medicine, the patient has come in the second sitting and there is no improvement. But now we'll come to the scenario where the patient has been prescribed with some medicine, and the patient has come for us in the follow-up also, and the same medicine was prescribed and it was showing a good improvement. But after some time, the patient stopped acting to that particular medicine. So again, what we should do in any case, if the medicine is not acting, then the first thing to do always keep in mind is to rule out maintaining causes from the patient side. Then the next possibility we can do is increase the potency and see, and most often the increase of potency itself will clear the problem. Even Kent says the same thing, and also Hahnemann has found out and given the same instruction even long before Kent has given us the idea. So next is a concept of intercurrent medicines. Hahnemann himself has found that sometimes when he was using sulfur in higher dynamizations, it was not giving the result after some 2 or 3 repetitions. And he found that some intercurrent remedy, interposing some other medicine, especially he was mentioning about hepasulf and other medicines. If and again, it is not a specific medicine; it is as per the based on the requirement of the patient. This medicine again puts the patient back into the normal state so that the patient can receive the same old medicine which can produce the expected result. So in this point, maybe we can consider anti-miasmatic medicines also, and also we can consider nosodes. Nosodes have very beautiful effect in our day-to-day clinical practice. They bring about such a beautiful improvement. The first few prescriptions have brought about a level of improvement, but it comes to a standstill state. Then we prescribe some nosodes based on the indication of the patient. The most frequently used nosodes are like carcinosinum, otherwise tuberculinum, even lysinum. These all medicines based on indications we use, and we see it produces such a very beautiful improvement and it clears the case of the path. So intercurrent medicines can be thought of if you found that the medicine was working till the present day, but now it is not working. Sometimes none of these work, so maybe then we have to go for a change of medicine, and we have to consider the relationship of medicines here before going into a new medicine, unless medicine is like very clear cut indication is there. Otherwise it is always wiser to go with the relationship of medicines. Again, the Boeric's section will help us in selecting the suitable medicine here. So now coming to the other possibilities. So now we already completed amelioration cases, then aggravation cases, and no change cases. Now we'll go for other possibilities. So now the patient is coming to you after your prescription and comes and tells that there are some new complaints or new symptoms that have come up. So here the first possibility we can see is a disease aggravation, where the medicine has not acted at all, but the disease is progressing like that. So this is an example that I am showing. This is not an original case, but an example for you. It is a case of fever. It is there for almost 2 weeks. There is some abdominal complaints are there, and constipation is there. And after some, you have prescribed medicines for that. And after some 1 or 2 weeks, the patient is coming back and telling that the new eruptions have come up. So here, the case, the diagnosis is, if you, I think you would have identified easily, it is a case of typhoid where rose spots starts appearing in the chest and other parts. So here it is the natural progression of the disease that is happening. It is neither a medicinal aggravation, it is not a homeopathic aggravation, because we should not confuse that. Sometimes as homeopaths, we expect, okay, it has come out as a skin eruption, then it is good, it is our action of the medicine. So we should not misunderstand the action of the medicine with the natural progression of the disease. So we should always be very clear with what disease diagnosis we are dealing with. So next comes a medicinal aggravation. It is like equivalent to like Ken's 10th observation, where the medicine we had given is like not correct. The susceptibility of the patient is also like very little, very high, or maybe the patient is a little sensitive. He had given a dose and the patient started coming up with a lot of symptoms that are unhomeopathic to the case. It is not that the existing symptoms are getting aggravated, but new set of symptoms are coming up that was not related at all to the case. Then probably it is a case of medicinal aggravation. And here again, as I already told you, first we have to rule out all the maintaining causes or obstacles to the cure. And if no obstacles to cure is observed, then it definitely indicates that there is a wrong selection of medicine. So what to do in these cases? It is ideal if it is very mild aggravation, then probably we can wait, or we can, even if it is an acute case, then we can directly go for the next suitable medicine based on the totality which is existing now. Otherwise, if the complaint is like severe, if the aggravation is little severe, then we can easily go for antidotes based on the symptom similarity or based on the relationship of remedy section of Boeric. Easily we can select an antidote, and then later we can consider giving a suitable medicine in these cases. So again here repeatedly another instruction from Hahnemann only: dose. Even if the medicine is right or even if it is wrong, it is always ideal to give the medicine in the smallest possible dose, because if it is acting well, then it will act well without causing much of homeopathic aggravation. And if it is not acting as we expected, then it may produce an aggravation, but the aggravation will be mild if the dose is small. If it is like too large, then definitely it gives too much of trouble to us also and for the patient also. So Hahnemann instructs very clearly, it is the moral duty of a physician to remedy this kind of a problem and acknowledge that we had did a mistake, and then we have to antidote the case and then put the patient back to health. Okay. Now coming to the concept of accessory symptoms. This, I think we all know what is meant by accessory symptoms. There are two types of accessory symptoms. One is of the patient and one is of the medicine. So this we are speaking about the accessory symptoms of the medicine. So when it is observed, a patient has come to us, we are taken the case and we are prescribed a medicine. In the first sitting only, we understood that there are no much characteristic symptoms available in the case, and we understood this is a one-sided disease or maybe a local malady, and we were like not very sure of whether the first prescription made was right or wrong. But with whatever available symptoms, we made our first prescription, we took our first step. So here what we observe, after the medicine is given, probably some symptoms might be better and some new kind of symptoms, or maybe like already existing symptoms which the patient forgot, will become more prominent. Okay, so how to proceed then? We have to consider these symptoms also into the totality, and these symptoms will help us to refine our totality, because our first problem was lack of symptoms. Now these symptoms will help us to understand more about the case, and the totality can be refined, and we can try to find the more similar medicine, and this way this could be continued in a zigzag way till the complete cure is like done. This is far more frequently happening in our clinical practice than every time giving a single dose and then immediately expecting a cure. So sometimes facilitation prescriptions are made because where there is no lack of reaction is there, no expected reaction is there, then we facilitate. For example, in aphorism 183, Hahnemann has given an example of an acute condition where the symptoms are not very prominent, and that is why not able to select a particular medicine. He tells that this is probably because of a benumbed state of the nerves, and in such cases Hahnemann instructs us to give a single dose of opium in higher dynamizations, and he tells that during the secondary action of this situation, probably the symptoms will become more prominent. This is the logic that Hahnemann has given, which later we are using it in the name of no sorts or like lack of reaction remedies, which is given by other later stalwarts. Now coming to the accessory symptoms of medicine in case of acute diseases, then we can immediately choose the medicine. If it is not severe, then immediately we can choose the medicine considering the newer totality and go for that medicine. If it is in a chronic state, then maybe we can go with the layer prescription, like zigzag prescription. And this is where Hahnemann mentions about in 171 aphorism. In most of the chronic conditions, it may not be possible to just give one single dose and finish the cure. Many times we may have to go with succession of series of medicines, often antipsoric medicines or anti-miasmatic medicines, based on the evolving indications, and ultimately we can reach to the cure. So practically speaking, we all know nowadays many of the patients come up with masked kind of symptoms, and it is difficult for us to get the complete picture. Maybe they don't give the complete picture, or the complete picture was long lost due to suppressive methods. So in such cases, accessory symptoms help us in refining the totality, and also will help us to cure the patient. Now all these cases, whatever we are seeing in the last scenario, patient is going to come and tell that the complaint has new complaints have come, but we have to identify whether it is in the right direction or in the wrong direction. So this is another scenario. This is also frequently seen in our practice, alternating diseases. This is like a patient is coming to us in January, we for some complaint, we are seeing him continuously. Then in June or something, rain starts and patient comes with some rheumatic complaints, and we expect, okay, the medicine has produced this effect, and this is where we make a mistake. So if you question properly, probably you can see that regularly now and then, 1 year or another year, they will get this complaint in the rainy season. So this we have to understand, this is like an alternating kind of picture, alternating diseases. One group of symptoms alternate with another group of symptoms in different timelines, maybe one in winter and one in the rainy season. So here Hahnemann instructs us, we have to consider all the symptoms together of different timelines and consider a single totality, and this will help us to refine our cure. So this is also something very important, how to easily identify that. Just ask the patient if they had similar complaints in the past, even before taking homeopathic medicines, and this will help us to understand. Okay. So next is the wrong direction. I'm sorry, I'm taking, madam, can I proceed for another 5 minutes?
Yeah, sure, sir.
Okay. Wrong direction or metastasis, this we all understand. This is like the typical case of suppression. It is going opposite the direction of Hering's law. It is going for a suppression, and definitely we have to go for an antidote here. So maybe the case is, instead of going from above downwards, it is going from below upwards, or maybe from a superficial layer, it is going for a deeper layer. So this we have to have a nuanced understanding about how disease works, and Hahnemann calls this as metastasis. It is always ideal in our treatment for the disease to go from the deeper levels to the superficial levels. But if it's opposite, then it is not at all a good direction. The Kent's example of a typical example of a rheumatic disease, where the complaints from the knee joint after treatment leaves the knee joint, the complaints of the knee joint are better, then goes to the heart. This is a typical example of wrong direction or metastasis, which should be avoided at all costs. And how to understand that? Again, seat of the disease, change of seat of the disease, and also the general symptoms also will help us to understand whether it is going in the right direction or in the wrong direction. So this is the next layer of symptoms. Like already told you, Hahnemann has already told, whenever we give an antisodic or an anti-miasmatic remedy, it will lead us to another layer of symptoms, and this new layer will help us to select or refine the prescription, and then reach the cure in a zigzag manner. So sometimes this is required, and maybe if the general symptoms are like good and only particulars are not good, then maybe we can with confidence proceed further with the selection of medicine. Maybe our previous medicine has acted curatively only. So this is what Hahnemann has told. Next, about house cleaning or elimination symptoms. So this also we see frequently in our practice. Sometimes after our medication, they will come up with some sort of elimination symptoms. Maybe there is a diarrhea kind of complaint, or maybe increased urination or increased sweating, or like increased expectoration. These kind of complaints we can often see. Patient comes and tells that, doctor, I have got a new complaint now. But probably the medicine is acting in the right direction. You look at the general state of the patient, probably it will be improved. So Kent calls this as house cleaning or elimination, and it indicates that the medicine selected is correct and we should not disturb such actions. Next is exteriorization. That is similar to means elimination symptoms, where the symptoms go from the deeper layers to the superficial layers, and often easy to understand is the skin. It comes out. Maybe if you ask carefully, the patient had in the past some skin complaint which was suppressed, and that has come out now. And if our medicine is truly right, we don't have to worry about this exteriorization, because probably it will go away. It is just a passing by symptom, and we don't have to worry too much. And the thing we have to understand here is our medicine is correct, and do not disturb the case. Wait and watch. Okay, so these are the different possibilities that are commonly observed in cases where we had used a medicine in a centesimal scale of potency. And now we will see little bit about the 50 millisimal scale of potencies. First, a point about 50 millisimal scale. Why Hahnemann has introduced it? Already I told you, Hahnemann is a very sensitive personality. Hahnemann wanted cures to happen as quickly as possible and with minimal aggravation or no aggravation. That's where the point gentle is very important for him, and that he was able to achieve with the help of 50 millisimal potencies. But the problem was the concept reached homeopaths very late because of the delay in publication of the 6th edition. Otherwise, to theoretically speak or even practically to speak, this is the most superior kind of prescription or potency among all the things, because when we start using 50 millisimal potencies, these many follow-up options we had seen, most of them are out of question. We'll have very limited possibilities. Either it will improve, otherwise it will not improve, and if the aggravation is there, it will be like very mild. Even if it is a severe pathological case also, we need not worry about the Kent's first and second observation. So almost all the problems what we had with the centesimal scale of potencies are like absolutely refined with Hahnemann's 50 millisimal scale, and that is the reason why Hahnemann himself calls 50 millisimal potency the most perfected method, and that is not being used so widely, and we have to start adopting 50 millisimal potencies. And these observations are actually based on a study that we had conducted in our institution, and very limited number of observations were observed even in a wide variety of cases, ranging from small acute, simple acute cases to deep pathological conditions. So this is an indication that we should start using 50 millisimal potencies more than what is being used now. So the observations that we found initial aggravation followed by amelioration. So this is also usually seen. Your prognosis is good. Maybe the dose was little larger than required, and that is why it happened. The next one is amelioration without aggravation. This is the most frequent observation with 50 millismol cases. There is no aggravation at all. Then amelioration followed by transient aggravation. This Hahnemann calls it as Sheen symptoms. If you remember, usually in centesimal scale of potencies, we expect a homeopathic aggravation to happen in the initial few days in chronic disease or initial few hours in acute diseases. But in case of chronic disease treatment with 50 millisimal potencies, usually we see the aggravation happening on the end, the similar kind of homeopathic aggravation. So this indicates that the cure is nearing the end, and what we have to do is simply reduce the repetition. Another beautiful thing about 50 millisimal potency is like there is a easy option available for repetition of medicines without the worry of aggravations or any complications. So the next observation is amelioration of symptoms up to a certain extent. Again, this is similar to Ken's seventh observation where the prognosis is poor because the case is incurable. What we can do maximum is palliation. Next is appearance of new symptoms. This also we found in some cases, but the advantage here is it is not going to create a very longer period of aggravation, but the aggravation might be like, or the newer symptoms pass away very quickly than expected without creating any deeper pathology. Then reappearance of old symptoms was also observed in some cases, and of course this is again according to the direction of cure of herring, so there is no problem. So as I already told you, Sheen symptoms is what Hahnemann calls for the end aggravation that is happening when we use 50 millisimal potencies, and they indicate that the homeopathic medicine selected is correct, but maybe the dose and the repetition can be reduced in the end. So we had seen lot of scenarios on the patient basis. When the patient is going to come to us, then what can do, that is what we had seen. So to conclude, the basic point we have to keep in mind is we have to be cool whenever we see a patient during a follow-up. We should not be forced or become anxious or too much stressed with the words of the patient telling that the patient complaint has not become better or slightly better, those things. So we should not be like pushed or like forced to prescribe or to change the prescription due to patient's word. We have to look at it very rationally, keeping the calm in our mind. And how can we do that? If we know the various possibilities that are how possible after a prescription is made, then we can be very sure about what we are doing and what is happening to the patient, and we can take a very confident step so that the cure is happening at the end. So that's all I wish to tell about this. So these are the references that I have considered for this case, and a small note about the textbook, that is Spirit of the Organon, a treatise on organ of medicine, written by Dr. Tapan Chandra Mondal. I think everybody has been using it for so many number of years. So this is the revised edition that has come up recently, and if you are a student of homeopathy or a CBDC student, then definitely this book is a must-have book. It helps us to understand in a practical basis. Many case examples and practical examples are given. So I am very proud to say that I am one of the contributor for this book, and I would definitely recommend for a beginner homeopath or even an advanced homeopath. So I would like to acknowledge Homeopathy 360 team, and especially Dr. Noori ma'am for allowing me and inviting me for this wonderful webinar. And also I thank BJN Publishers and also Dr. Sheetal Panpalia for this opportunity. And also thank Yanapoya Deemed University for the support and guidance. Thank you all. Thank you, ma'am.
Thank you, Dr. Vivek. Your presentation was exceptionally informative and engaging. And thank you for sharing your expertise with us, and grateful for your time and so much knowledge. I hope the audience felt the same. The work on Homeopathy 360 is dedicated to building a global knowledge hub where, the academic content, clinical insights, research, innovation, everything is freely accessible to all. And the platform truly lives to its motto, you think, we link. And you have pretty much done the same. So, to the audience, if you have any experience, any knowledge, insight that you want to share, we welcome you to contribute on Homeopathy 360. Thank you so much, Dr. Vivek, and thank you, audience, for patient listening. Good night, everyone.
Thank you, ma'am, and thank you all the participants for patient listening. Thank you all. Thank you.
Goodbye.